Hi, everyone. Good evening or morning to everyone joining us today. Welcome to the Global Learning Collaborative's first climate webinar for the year. Today, we explore how to navigate mental health impacts on communities in a climate change impacted world. Please drop a hello in the chat and let us know where you're from. Now, climate change can have slower, gradual, direct impacts like increasing heat stress as well as sudden events such as increased frequency and intensity of natural hazards, while indirect effects of this climate change are harder to tie to poorer mental health. Extreme weather occurrences have been shown to have long-lasting effects on mental health outcomes through exposure to trauma, leading to post-traumatic stress disorder, major depressive disorders, anxiety, depression, and self-harm. We know, for instance, from natural events historically. For example, the 2005 Hurricane Katrina, an estimated 31.2% of survivors experienced anxiety mood disorders following the disaster. Another example is in Bangladesh in 2019, after the monsoon flood, the survivors had a staggering 57.5% had suicidal ideation and 2% had attempted suicide. Now, these impacts can be compounded in communities with existing mental health illnesses, and especially where there is stigma associated to the mental illnesses and where access to such services is already poor. There are nearly 1 billion people living with mental health conditions, yet in low and middle income countries, 3 out of 4 do not have access to needed services. According to Deborah Kestel, Director of the Department of Mental Health and Substance Abuse at WHO in 2022. So, in the context of health system resilience, which is what the Global Learning Collaborative focuses on, how do we recognize climate change's impacts on mental health? How does this impact communities in different ways and at different levels? And how can communities and countries include mental well-being when planning to mitigate and adapt to the impact of climate change on their communities effectively? This is what we're going to try and touch on today in this 1-hour webinar. Today, we have 2 climate and mental health experts with us to provide a primer on some of these aspects. We'll begin with the presentations from Professor Mala Rao and Associate Professor Renzo Guinto, and we will begin their presentations followed by a panel discussion and open up for Q&A. Please drop your questions in the chat box. You can do that throughout the presentations, and we will pick and curate some of the questions during the panel talk. Welcoming Dr. Mala Rao, Professor Mala Rao. She is the Director of the Ethnicity and Health Unit at Imperial College London. She also chairs the WHO Southeast Asia region's expert group on environmental determinants of climate change and health. She is also the clinical advisor to the UK General Medical Council on Equality, Diversity and Inclusion and Vice Chair of WaterAid UK. Professor Mala is a recognized champion of climate action, safe water and sanitation, and gender equity. She is also globally respected for her advocacy of race equality and research on the intersection between race, health, and climate. She has published many papers, co-edited the Health Practitioner's Guide to Climate Change, published in 2009, and contributed to the UK and other governments' reports on climate and health. For her contributions, Professor Mala has received several awards, including an Order of the British Empire, OBE, in 2013, the Faculty of Public Health's Alvin Smith Prize in 2021, and most recently, the Commander of the Order of the British Empire, CBE, for services in public health, the NHS, and to equality and diversity. Over to you, Professor Mala. Looking forward to your talk.
Right. Well, Aman, other colleagues at Access Health, thank you so much for that generous introduction, Aman. What a privilege to be invited to contribute to this webinar on navigating mental health impacts in communities. Next slide, please, Miguel. I'd like to begin by acknowledging some of my Imperial College London colleagues and institutes for allowing me to share their slides, pictures, data, and evidence today, and to acknowledge the inclusion of some publicly accessible data from Cambridge University and reports from the United Nations and other agencies, as well as from papers published in the 2022 special issue of the International Review of Psychiatry on the Climate Crisis and Mental Health, which I had the privilege of being invited to guest edit. Next slide, please. Signs of climate breakdown are evident everywhere across the globe, from wildfires in the US and Europe to heat waves in India and the UK and devastating floods in Pakistan and Libya. Record-breaking extreme weather events are occurring in every continent, increasing in frequency and intensity. And less well publicized, but just as devastating, is that water stress and water scarcity are expanding across geographies and intensifying, especially in the poorest and the most fragile regions of the world. Next slide, please. The first scientific check for the entire planet concluded recently that 6 of the 9 planetary boundaries defined by scientists as essential for a healthy planet have now been breached because of human-caused pollution and the destruction of the natural world. Scientists have now concluded that the Earth is well outside of the safe operating space for humanity. And in his starkest warning, Antonio Guterres, the Secretary General of the UN, declared that the age of global warming was over and that the age of global boiling had begun. Next slide, please. The current 10-year mean heating is 1.14 degrees C above pre-industrial levels, and the impact is enormous and increasing. And as you can see from these cartograms, greenhouse gas emissions are disproportionately much greater from the global north, as you can see from the top cartogram, and the health impacts are disproportionately much greater in the global south. The 46 least developed countries, home to 1.1 billion people, accounted for less than 4% of greenhouse gas emissions, but 69% of global climate-related deaths in the past 50 years. Next slide, please. Climate change is the biggest health threat facing humanity, a fact that has been recognized for some time. So how does climate change impact on health? It affects health through a complex interplay of changing environmental conditions, ecological processes, and socioeconomic landscapes. Health is affected through a variety of pathways, which include more frequent and intense extreme weather events, as Iman mentioned, heat waves, drought, water scarcity, air pollution, and changes in the rates of reproduction, survival, and distribution of infectious organisms and insect vectors of disease. The results are an increase of the global burden of mortality and morbidity from conditions ranging from drowning and physical injury, heat stroke, cardiovascular and respiratory disease, gastrointestinal infections, vector-borne disease, and mental disorders. Next slide, please. Now, furthermore, climate change has indirect impacts on health through pathways such as the destruction of livelihoods, inability to access health care, crop failures leading to food insecurity and malnutrition, loss of cultural identity and tradition, forced displacement and migration, conflict, and mental health. And none of these can be separated between physical and mental health conditions because they're all so inextricably linked. How can you be starving and not also be mentally distressed? Next slide, please. And as UN Women reminds us, gender inequality coupled with the climate crisis is one of the greatest challenges of our time. It poses threats to ways of life, livelihoods, health, safety, and security for women and girls throughout the world. And as Kavita Ramdas, president for the Global Fund for Women, said some time ago, the gender inequalities that define women's lives prior to a climate disaster are really what put them at such greatly increased risk from climate change. Next slide, please. But if all this evidence is not enough, let us consider what Professor Julian Allwood of Cambridge University highlights in his reports. In his view, the most alarming projection is that if the current trend in global emissions continues, the world will run out of food by the end of this century, leaving over 1 billion people living near the equator at risk of starvation as a result of climate change. And that is an unimaginable tragedy. Next slide, please. So now, what are the mental health impacts of the climate crisis? Estimates of the impacts of climate change on physical health have been ongoing for some time. However, despite the recognition that the mental health toll is likely to be as severe, fewer efforts have been made to date to quantify that burden, study its extended impact on society, forecast its effects on future socioeconomic and climate trends, and explore ways by which the negative impacts could be addressed. This is likely to be associated with the fact that there is already a significant unmet mental health need which exists globally, even before the additional mental health impacts of climate change are considered. And in that regard, all countries are developing countries when it comes to mental health, as Patel and colleagues point out in a paper in the Lancet. Next slide, please. Thankfully, mental health impacts are receiving greater attention in recent years. And so what are they? The inextricable links, as I mentioned, between physical and mental health and myriad pathways by which climate change affects physical health are also those which affect the mental health and well-being of communities. High, extreme, and variable temperatures worsen a range of outcomes, including increased cases of suicidal thought, suicide rates, hospital attendance, and admission for mental disorders, but also worsen population mental health and emotional well-being. An approximate 1% increase in suicide incidence has been reported for each 1 degree C temperature increase above the local ambient temperature threshold, and an associated 2.2% increase in overall mortality related to either suicide or other mental disorder. There are worsened mental health outcomes of people living with a range of mental illnesses, and this may be at least partly attributable to the effects of psychotropic medication, which impairs the body's ability to regulate temperature, exacerbates the risks of heat stress in such individuals. Extreme weather events are associated with increased diagnosis of post-traumatic stress disorder, depression and anxiety, and a number of other conditions. And who can doubt the anxiety related to migration when homes and lands become uninhabitable? Even for those who are not displaced, communities with a strong emotional, cultural, and spiritual connection with their habitats and lands, such as indigenous people, are witnessing the destruction of their homes, environments, ways of life, and their mental health and well-being. Next slide, please. A word about air pollution, because its links with physical health, such as cardiovascular and respiratory disease, are well known. But air pollution, especially particulate matter and nitrogen oxides, increase the risk of mental health problems too. Exposure to different components of air pollution has been linked to higher rates of depression, anxiety, bipolar disorder, psychosis, schizophrenia, dementia, and increased suicide risk. Next slide. Impacts being big. Well, next slide, please. Yeah, thank you. With climate impacts being experienced in every region, also on the rise is eco-anxiety. First described by the American Psychiatric Association, Psychological Association, I beg your pardon, in 2017. The term refers to the chronic fear of environmental doom. It isn't a formally diagnosable condition, but is becoming increasingly well recognized by the mental health professions and the public. The true burden of its costs have yet to be estimated, but are likely to be significant. And it matters because experiencing climate change effects is associated with increased risks of mental ill health across a range of conditions from depression to PTSD, and further deterioration in those with a history of mental illness. Next slide, please. Eco-anxiety is affecting reproductive choices, as one study carried out in the US has shown. And what is chilling is that this diagram in a recent intergovernmental panel for climate confirms that the fears of these respondents in a 27 to 24 age range US survey is not at all exaggerated. Look at the 3 rows of people representing those who were born in 2020, perhaps some of our children or grandchildren, those born in the middle row, possibly representing some of yourselves, and 1950 in the top row, current seniors. Note how hot and different each cohort's world will be by the capacity, depending on the future greenhouse gas emissions pathway we choose. Next slide, please. Children and young people are experiencing high levels of eco-anxiety. A 2020 survey of child psychiatrists in England highlighted that more than half are seeing children and young people distressed about the climate crisis. Another UK survey in 2020 found significantly higher levels of distress among 16 to 24-year-olds for climate change than the COVID pandemic, driven by relatively higher distress for climate change in people who do not otherwise experience anxiety in their daily lives. Next slide, please. And the largest and most international survey of climate anxiety in young people aged 16 to 25 surveyed 10,000 respondents from 10 high, middle, and low-income countries and exposed the psychological burdens these young people are suffering. Typically, and not surprisingly, respondents from the global south who may have experienced climate change aspects expressed more worry and greater impact, but significant numbers from all countries reported feeling very worried, and their feelings affected their daily lives. Especially poignant was that their emotions were linked with feelings of betrayal and and abandonment by governments and adults, leaving them with no future and humanity doomed. Next slide, please. We need to act now. Business as usual is not an option. We all need to recognize that the climate crisis is a public health crisis. It's going to cost less to act now than not to act. That technology may help, but may also not help, and it may be too late. And the solution is very large part is changing how we live and work and enjoy the healthcare benefits of a sustainable world, which are likely to be extremely significant. We need to balance anxiety with hopefulness, and we might begin with knowing our facts, becoming better informed, and joining forces with like-minded colleagues and friends to lead action. Next slide, please. I was interested to read a Cambridge University team's estimate that if everyone in the UK were to reduce their carbon footprint by a modest 6% a year, the country could achieve net zero by 2050. Try and find out what the estimates may be for your country, because if you come from a lower middle income country, it may even be less. We all have the opportunity to contribute to climate action as individuals, members of a family, network, and community. In relation to mental health policy and practice, those who can influence mental health systems may want to consider the urgent need to build sustainable mental health delivery systems, to recognize the false dichotomy between human health and ecosystem health, and the benefits of nature-based activities in the options available for mental health interventions, and learn from each other, such as the strategies to address the mental health impacts of climate crisis through embedding mental health first aid into Bangladesh's mental health system, something I am so proud to have been associated with. Next slide, please. The other dimension, of course, is changing one's own actions and lifestyle. In the UK, 75% of adults are worried and ready to take action with us. Climate psychologists recommend that practical anxiety is good because it enables problem solving and improves well-being, and translating anxiety into action is an effective way to manage emotions. And I would suggest activism through non-cooperation with expected norms. And let me show you what I mean by this. Next slide, please. So, contrary to current expectations as to how we should lead our lives, may we consider reducing meat and dairy and moving to a more plant-based diet, and improving mood and mental health and well-being as a result. We could reduce air pollution by reducing car use, taking more People in our car going electric, changing to walking or cycling, and stopping flying when unnecessary. Should all conferences become virtual, such as this one in future? Air pollution is linked with mental disorders and dementia. On the other hand, active travel benefits mental health and well-being. Next slide, please. We could, in cold countries, advocate for insulating our homes. We could bring nature into our homes and enjoy and protect natural spaces because that benefits mental health and well-being and biodiversity. Next slide, please. We could buy less and be happier. We could reuse, reduce, recycle, repair, and all of that improves sustainability and indeed improves our mental health and well-being. We could spend and invest money in ways compatible with zero emissions, and we could absolutely use our voice and our trusted position to educate our community, schools, political leaders on mental health and sustainability and that link between them. Next slide, please. So, in conclusion, humanity's survival is at stake. We all have the power, influence, and opportunity to transform societal engagement in climate action, change despair into hope, especially for our vulnerable populations and our young people. This gathering demonstrates how much scope there is for global collaboration and solidarity to achieve a sustainable future for everyone everywhere. I call you all to act to achieve this ambition. Thank you, Emma, and thank you all for listening.
Thank you, Professor Mala. This was an excellent talk to just set the context for the discussion later. So many points, and I think the utmost important point is how mitigation and climate action is central to every conversation where climate change is talked about, and that you can't really separate one from the other. And I will come back to more on this when we get to the panel discussion. Moving with Dr. Renzo Guinto with his talk. To introduce you to Renzo, he is Associate Professor of Global and Planetary Health at the SingHealth Duke NUS Global Health Institute, Duke NUS Medical School, National University of Singapore. He's also Visiting Professor and former Director of Planetary and Global Health at the St. Luke's Medical Center College of Medicine in the Philippines. Renzo is a member of the National Panel of Technical Experts of the Philippine Climate Change Commission, World Health Organization's Technical Advisory Group on the Ethics of Climate and Health, editorial boards of several journals, including the Lancet Planetary Health and PLOS Global Public Health, and 2 Lancet commissions, including the Lancet Commission on Sustainable Healthcare. An Obama Foundation Asia Pacific leader and Aspen Institute New Voices Fellow, Renzo has served as consultant for various organizations, including the WHO, World Bank, USAID, and Wellcome Trust. He currently serves as convener of Planetary Health Philippines and the chair of the Committee on Environmental Health and Ecology of the Philippine Medical Association and of the Thematic Working Group on Climate Resilient and Sustainable Health Systems of Health Systems Global. In 2020, Renzo was included by Tatler magazine in its Gen T list of 400 leaders of tomorrow who are shaping Asia's future. So proud. In 2022, he was named one of the outstanding young men and women of the Philippines for pioneering in the field of planetary health in the country. Without further ado, over to you, Renzo. Looking forward.
Thank you very much, Iman, for that very generous introduction. I'm borrowing Mala's words. And as always, it's a pleasure to be speaking with my dear friend and colleague and collaborator and mentor, Mala Rao. And thanks to Access Health for this wonderful opportunity. It's actually the first time I'm being introduced as an associate professor of the National University of Singapore. I'm 1 week fresh here in Singapore. And so I look forward to meeting our Access Health colleagues, which I believe are just a few streets away from where I am right now. But in the next several minutes, I was tasked to talk about climate and mental health. I think Mala already gave a fabulous overview of the discussions, the emerging evidence. What can we do within our sector, the health sector, in order to address climate change and mental health? In my presentation, I will be reinforcing a lot of what Mala has already mentioned by using examples, case studies, and again, ongoing discussions, discourses, insights from the Philippines, my home country, and also at a broader level, Southeast Asia, where we are right now in. So let me just introduce first a phrase that you've heard from Iman's introduction of myself, planetary health. I always remind my medical students, whether in the Philippines or now in Singapore, that in this day and age, we physicians, health providers, health workers now have to treat two patients, not just the people, but also the planet. That is what planetary health is all about. And one of the major planetary health challenges that we are now facing is climate change, as already highlighted by Mala. We know climate change affects human health in many different ways. I will not belabor you with the details of this diagram, but as you can see, many arrows, many boxes, it means climate change affects health through many different pathways. And on your right, you will see that really there's no single disease group that is immune to the effects of climate change. You name it, infectious diseases, heart disease, nutritional status, all of these will be affected. And of course, our session today is focusing on mental health because climate change also shapes the health of our brains and our hearts. And we know that our region, Southeast Asia in particular, is a climate hotspot. This is the map of ASEAN, Southeast Asia. In this map, the redder the country is, the more vulnerable the country is to climate change. And unfortunately, my home country, the Philippines, is the reddest of them all. And so, the Philippines, of course, but also its neighboring countries are already beginning to experience climate change, its health effects, and most especially its health effects. And of course, we know that, our region, especially the Philippines and some of the other countries, thankfully not Singapore, is very, very susceptible or vulnerable to extreme events such as typhoons and intense flooding. And we know that when these extreme events do occur, you see the destruction of houses, livelihood, farmlands, electricity grids, school buildings, and even healthcare systems. This session is part of a series around resilience in health systems, and certainly, as you can see, there's a challenge to ensure that our health systems do not break, do not bend, or do not get destroyed when climate change happens. And in the Philippines, we've seen not only climate but also COVID, happening at the same time. Unfortunately, in an increasingly unstable world with all these different risks, threats emerging, we can anticipate more of these occurrences happening in the coming years. And it will affect our health systems. It will affect our physical health. It will also affect our mental health as well. And it's not also only about the extreme events, the typhoons, the flooding, the landslides. We also need to pay attention to what we call the slow onset effects of climate change. Take, for example, sea level rise. The Philippines, my home country, is a country that is facing or already experiencing some of the fastest rates of sea level rise in the world, around 5 times that of the global average. And we know that when the level of the sea continues to rise, the seawater intrudes into freshwater systems, people begin drinking, consuming water that is high in salt content, and worse, they have to even be relocated or forcibly displaced because the sea level, when you go to these communities, the way the communities will describe it is it's as if the sea is devouring their homeland, their habitats, their houses, their farmlands, etc. And then, of course, increasing heat is the experience of heat is also becoming an issue now. Whether you're in the Philippines or even in the Singapore, which is a highly urbanized city state. And there's also emerging evidence, as already alluded to a while ago, that even our experience of heat is going to make us more irritable, more anxious. It affects our mental health. It influences our, different kinds of emotions. And so again, it's not only about the typhoons. It's not only about sea level rise. Even heat is going to influence the way we think, the way we behave, the way we feel. And so I think what I just described to you is summarized in this diagram. I invite you to take a look at this report that was actually developed by colleagues at Imperial College London, which summarizes the current state of evidence as to how climate change affects mental health. And in short, climate change affects mental health through abrupt and catastrophic and dramatic ways, through the typhoons and the flooding, the victims, the survivors. They acquire, and experience different kinds of trauma, which can last for weeks or even last for a lifetime. And then on the other hand, you also have communities that are experiencing the slow changes brought about by climate change, their house being inundated by sea level rise, their croplands, their farmlands not anymore able to produce, food, or, declining fish catch because of, the destruction of coral reefs in marine ecosystems. These are slow onset effects that are also affecting the mental health, for example, of our farmers and fisher folk. So we have to really look at the entire spectrum of effects if we are going to build resilient health systems that take care not only of our physical health, but also of our mental health. So, I already alluded to this. The Philippines has a long-standing experience when it comes to these extreme events. And of course, when typhoons do happen, the people, the communities, they experience trauma. They lose their livelihood, their houses. They have to, start, new lives even. And that certainly creates a wide array of, different forms of mental and emotional distress. Although, you might have seen this on social media. Every time there's a typhoon, Filipinos are able to get back to their feet right away and go back to, their business, everyday business. This is a very powerful photo that was taken in 2013 when Typhoon Haiyan hit the Philippines. And a few hours after the flooding has subsided, you will see Filipinos already praying and parading and worshiping. Where the Philippines is the only predominantly Catholic country in Asia, so religion and faith might have a role to play in that. But it's interesting to really look into how the communities of Asia are responding to these climate effects, not only physically but emotionally. And then, as I've already kind of alluded to as well, this is an emerging discourse in the Philippines. I'll not go into the details of these papers. You can take a look at, these recent publications. Some of them I was also involved in. And this is a conversation that is already, vigorously emerging, evolving in our country. And Mala already mentioned this study. 10 countries were studied. A cross-sectional survey was done with young adults, and what was found out actually is that the Filipino young people who were surveyed are the most climate anxious in the world. Around 90% of the Filipinos that were surveyed said that they are at least moderately to at most extremely anxious about the changing climate. But it was already mentioned a while ago, eco anxiety, climate anxiety. It started, or that the concept was conceptualized first in, more Western settings. How does it manifest in Asia or in a low and middle income country setting? And that is what, John Naruta is my partner in crime in the Philippines. He is our foremost environmental psychologist. I'm a public health physician. And we've been really trying to investigate, is climate anxiety in the Philippine or in a Southeast Asian setting experienced differently compared to how it's experienced, for example, by the British young people or young people, let's say, in the United States or Latin America. And in this paper, we actually laid out some of our potential explanations or pathways, how climate anxiety is experienced, let's say, by the Filipino young people, because they have direct and indirect experience of extreme weather events. They also have direct and indirect experience of slow onset events. When we say indirect experience, it's not them directly experiencing it, but maybe it's their parents, their family, their friends, and knowing that you have loved ones experiencing such crisis and catastrophe, it also starts to affect you emotionally and mentally. But also education and awareness about climate change. Of course, it's important that people are aware about the issue, but we're also now looking at our curriculum. Is our curriculum, climate curriculum in the Philippines, making people feel more afraid rather than feel more hopeful and more empowered to act on the climate? So education can be a double-edged sword, right? It can be, more information can make us feel empowered and hopeful, but it can also make us feel scared and feel helpless. But also the awareness that there is insufficient global and local climate action. When you see political leaders, saying a lot of promises but not doing anything about the climate, it creates frustration and fear and anxiety among the young people who are really concerned, about their future. They're not anymore interested even in procreating because they're unsure if their children will live healthy and happy lives in an era of a warming planet. And then we started looking also at who are these groups that are more vulnerable than the others when it comes to the impacts of climate change on mental health. I'll not go into the details, but as you can see, there are many different groups. And one notable group that we are now looking into is even climate scientists, activists, and health workers, right? We're the ones supposed to take care of our communities. We're the ones addressing climate change, but also we are susceptible to the mental health impacts of climate change. In fact, there are reports that some scientists are not anymore interested in doing research because the politicians are not listening to them anyway. So they're feeling hopeless and helpless that the science that they generate are not creating a huge dent in the arena of policy and practice. And when we look at climate and mental health, we have to remember that people do not live isolated lives. They're not just affected by climate. They're also exposed to social media. They also just survived COVID. They're also hearing a lot of these instability in politics and in the economy. And so people do have different sources of anxiety and distress. And when we are looking at the climate and mental health nexus, we need to remember to look at these issues in a very holistic way, how they also relate to the other problems that are experienced, that are borne by everyday people. Young people is also a very, I already mentioned young people repeatedly for the past several minutes, because young people, they're the ones really feeling the frustration and the anxiety and the anger, but they are also finding ways to channel that anxiety into agency and action. So you will see a lot of young people involved in climate activism. They're organizing themselves. They are, sharing information through social media. And this is one thing that we may want to look into as well. How can we, turn the anxiety into action? And how can we create more collective activities for young people so that they protect their mental health while at the same time they do their part or do their share in protecting the planet? So, these are some of the challenges. And of course, even without climate change, the mental health system is already overburdened, right? I will not go into the details of this bullet point so that we have more time for discussion. But as you can see, our mental health systems, whether in the Philippines, as you can see here, but also in nearby countries, neighboring countries, they're immature, underfunded, under-resourced, manned or womaned. And the frameworks are just evolving. The Philippines just passed its Mental Health Act in 2019. So the question that we should be answering is, are we ready to build health systems that consider the climate? And I will even advance it to, are we ready to build mental health care systems that consider the climate? And the remaining slides that I'll show to you, hopefully will provide some principles, right? On how to do this. I just inserted this slide because it's very interesting. We're talking about resilient health systems. This collaborative is about health system resilience, but health systems are the health sector is the last sector to use the word resilience. And resilience has been already used by so many different disciplines and sectors, including psychology. We're talking about mental health, and more recently, climate adaptation and disaster risk reduction. And then when Ebola happened in Africa, that's when the health system started using the word resilience. We borrowed this term from the other disciplines. And so when we talk about climate and mental health, resilience can be a very useful term. And then, there are a lot of initiatives that have been emerging for the past several years. For example, this idea of building climate resilient and low carbon health systems. We need to think about how to make sure mental health is part of this agenda. We cannot just be creating a health system that can address dengue or undernutrition or water scarcity. And then we forgot about mental health, which is also, as already emphasized repeatedly, influenced by the changing climate. And then when we're looking for solutions, we have to go beyond the traditional clinical approaches to mental health, because what builds mental health resilience of people is not what we are offering inside the clinic or what we are providing inside the mental hospital. So we might be looking at potential interventions at the societal level, at the community level, or even at the interface between society and ecology. I'm sure you've heard of the concept of nature-based interventions, right? And there's growing evidence now that exposure to green and blue is actually good for mental health. But how can you prescribe green and blue medicine if your forests are destroyed and your rivers are not anymore blue because they're brown or black due to waste and garbage? So we need to start looking beyond as well the clinical interventions for mental health. We cannot forget about community engagement. They are the ones that will really drive the change at the local level, on the ground. And these are just some photos of what we've been doing in the Philippines to really not just train and educate, to raise consciousness, but to mobilize communities to become agents of mental health and climate protection. And we need to make sure we don't forget about the mental health providers, right? We're saying we want to grow our mental health systems, but we have to make sure they're not overworked, underpaid, and undervalued, right? And so in this article, we were talking about the plights, and also the promise of mental health providers in the face of climate change. And here are 4 C's. We need to make sure that there are the right conditions for work, especially salary and also non-monetary support. Capacity strengthening. We need to provide them with the training that they need and the resources that they need to be able to be effective in this work. We need to care for our carers as well, because as already mentioned, they're also susceptible to mental health impacts. And of course, the power of community and connection, right? We need to create these alliances, these networks of providers who share information, knowledge, but also share inspiration with one another. And we need to make sure that mental health is part of planetary health education. I already described to you what planetary health is a while ago. And so if we're going to create a workforce that is ready for climate change, we have to make sure they're also ready to provide first aid for mental health issues, especially those that are, induced by climate impacts. If we are going to pursue research and policy on climate and mental health, we need to make sure it's 3 I's. If you notice, I love alliteration. Intersectoral, interdisciplinary, and intergenerational. And that is what we've been trying to do in the Philippines. So for example, on October 10 last year, World Mental Health Day, we brought together climate people and mental health folks and anthropologists and business folks and young people and even indigenous leaders to come up to to have an exchange and a conversation in order to come up with exciting shared solutions. And again, I just want to emphasize the role of indigenous communities in this kind of work. And I just want to update you, we have an ongoing project. In fact, Mala is also involved here. It's called Connecting Climate Minds. Last year, we organized regional dialogues on climate and mental health. And my team in the Philippines was the one that led the Eastern and Southeastern Asia dialogue. Please visit our website. And soon we will be launching the regional and global agendas for climate and mental health. Again, this is a very new space. And so we had to undertake this international process of gathering stories, insights, and potential arenas for research. And of course, we need to make sure that we continue our national and international advocacy for climate action. At the end of the day, if we want to protect our mental health, we need to make sure that climate change is slowed, if not stopped, and that will require reduction of greenhouse gas emissions and continued advocacy at all levels from local to global. These are just some photos from the recently concluded COP28, and climate and mental health was repeatedly, highlighted in Dubai. Even the Minister of Health in the Philippines, in his remarks, explicitly mentioned climate and mental health as a priority. So to conclude, I'm wrapping up now. In this work on climate and mental health, I want to leave you with 3 Ds. Again, I love alliteration. We need to depathologize the conversation. It's okay not to be okay in an era of a warming planet. It's not a disease. It's a natural reaction, to be sad, to be afraid, to be frustrated towards, different kinds of stimuli, including climate change. We need to destigmatize the conversation, which is related, so that everybody is open to talk about mental health and climate change without fear, without hesitation. And we need to decolonize our approach. We can't just copy the intervention done in the UK or in the US and transplant it to Asia as if, there are no cultural differences, contextual differences. So we need a decolonial approach to this work. And hopefully we will be developing Asian solutions to climate and mental health. And then finally, hopefully, we are now at the start of in building a new field of planetary mental health, which I describe as mental health promotion on a planetary scale. We need to go beyond clinical interventions. As I've mentioned, a healthy planet is good for mental health too. So we need to get out of our clinics and our hospitals to act on the climate crisis. This needs to be truly global for all, universal and by all, which means decolonize, bringing in perspectives from different communities, especially indigenous and non-Western traditions. And it should be transdisciplinary, cross-sectoral, international, and intergenerational. And at the heart of it all, we should be espousing in this work the values of equity, justice, and sustainability. So together, let's advance the health, both physical and mental, of people and planet. Thank you very much.
Thank you very much, Renzo, for that lovely and detailed insight into specific health to sort of understand can you hear me?
Yes, we can hear you.
All right, sorry.
We cannot see you now.
Can you hear me and see me now?
We can just hear you, but not see you.
All right, that's all right. I'm going to proceed without my video. There's some technical issue. Thanks so much, Renzo. I think one of the things from both of your talks that really impressed upon me is the need for contextually really understanding mental health in a local context and in the Asian or global South context. And even when you mentioned with the disasters and having religion play such a huge role, and then taking indigenous belief systems, when we think about mental health, especially from a healthcare planning systems point of view, and we're trained biomedically in the Western thought process. How can people who are in the health system, in the health policy space, sort of bring these two worlds together? And should we? That's number one. I mean, for me personally, I strongly believe that is a necessity. But how does one really bring that together, where you have a culturally completely different viewpoint on addressing mental health, which could be something where you process trauma through religious beliefs or certain community health support systems, which can be completely different from, biomedical methods. Over to you both. Just want to pick your brain on how we could actually go about that.
Do you want to begin, Renzo? Yeah, okay. Well, Iman, that's an incredibly important question. I mean, I think the first issue is we haven't even, and this is at a global level, begun to recognize that storytelling and qualitative evidence is as powerful. In my view, it's even more powerful than the quantitative evidence is. And I felt for many decades, and I've been 4 decades in a public health physician involved in practice, policy, and research. It's felt a very lonely crusade almost to try and get the world to recognize this, because qualitative evidence is regarded with such contempt by our research funders in the past. And I use that word contempt quite deliberately because that is the way it was. Only now are they recognizing that they need to listen to stories, because Indigenous evidence and First Nations evidence may not be the kind of numbers and the way that Western science has evolved and decided to define itself is not the same, but that other systems are equally as powerful, if not more powerful, and more important for us to listen to. So, in fact, Renzo's, the project he was talking about, Connecting Climate Minds, is almost the first time I've come across a situation where a globally renowned research funder has said, please collect stories. So that's important. We start to listen to them. And when we researchers begin to collect data and evidence to sort out a policy relevant question, then we introduce that. And I can go on about big policy arenas where I have found that telling the story to policy leaders has convinced them of a certain action much more than the words convince them. I think that's the way to engage Indigenous and First Nation communities and start to take their views very, very seriously. The other thing is to recognize that many of our solutions to climate change now might lie with listening to their wisdom, because they understand nature. They realize they're part of nature much more than we've done. We've lost it for the last 150 years, and that's in the global north, in the industrialized parts of our countries. And we need to start listening to them. And I think the tide is turning, but far too slowly, in my view. And we have a need to accelerate that process. Over to you, Renzo.
Well, that's a hard act to follow, Mala, because I think you already highlighted what needs to be done. I think one thing that I just want to add is, what is needed in this kind of work is humility, right? That we're humble enough to recognize this is a challenge that no single discipline, culture, geography, country, entity, stakeholder can answer or can solve, right? And that's why, for example, you referred to our project. In this project, I think this is one of the most diverse set of people, stakeholders that I got exposed to. We're talking to, on one hand, some of the best scientists, for example, whether it's on climate or psychology, but on the other hand, we were engaging with representatives from fishing communities, indigenous leaders, religious leaders, right? Especially in Asia, where a region of so many different faith traditions. And when we were like coming up with the directory or list of who should be involved in the dialogue, we were thinking, oh, there should be someone who has some experience or expertise in Buddhism and Islam and Christianity and so on and so forth. So yeah, I think this is an exciting arena to bring a lot of people, a lot of stakeholders together to come up with solutions, to come up with new solutions, but to also discover old solutions, right? I think there's always this a tendency or obsession around, oh, what's the novel, what's the innovative, right? When in fact, oh, there are actually age-old practices that we need to revive, that we need to enhance, that we need to promote. And then I think the other thing is, we need to be very intentional now in this kind of work. because it's not going to happen spontaneously, unfortunately. And so I guess, Access Health is doing a lot of implementation work. I think a lot of our participants in the room or in the space of policy and practice, we need to be intentional in creating the spaces where all of these kinds of voices are taken into consideration, right? And that they are able to participate not tokenistically, but meaningfully. For example, in our project also, Mala, as you remember, we even have live experience advisory groups in every region. And we really scoured the entire region for people who survive mental health challenges amidst climate impacts. And we drew their expertise and insights to make sure that we are in the right direction. So those are some of my additional thoughts. Thanks.
Thanks so much, Renzo and Mala. Fantastic responses and a lot of words that resonate deeply with our own perspectives as we sort of bear the flag, so to speak, as policymaker, advocating for policy change in a space that sometimes gets ignored. And like you said, Mala, the contempt for qualitative research, the strength of it and the rich information that is there is often overlooked. I know that we are almost up on the hour, but I would like to request if we could give another 5 minutes additional for us to converse a little bit more, and we'll keep it open for as long. Mala and Renzo, could we have it for 5 to 10 minutes? Is that all right? If so, I welcome all of our participants to please stay on the call as well. But if you have other commitments, please know that we have this recording and we can share it with you as well later. And we can keep the communication lines open as well afterwards. So my next question actually ties in with a question from the audience, which is, how would we convince policymakers? Because ultimately, you have to have those interlinkages, and those need to happen, whether it's local councils, changing the structures that are necessary that will enable even community action on the ground, all of this. But to really advocate, how can we make policymakers really understand the importance of addressing this mental health as a central issue when they're looking at things like being re-elected, or when poverty is the highest priority? Over to you, Renzo.
Yep, thank you very much. And it's not a unique problem for climate and mental health. It's an issue that, or a problem that we've been facing in any arena, in any policy arena. Climate change in particular, I'm sure all of us here are frustrated that despite all these beautiful pronouncements, we need to protect the climate, we need to act on the climate, there's very little or slow progress at the national and global levels, in the energy sector, in the food system transformation sector, etc. So it's not a unique issue. But when it comes to climate and mental health, and I want to build on what Mala referred to a while ago, the importance of stories. Again, I love letters, alliterations. The first S is telling the stories, right? And if possible, we don't need to tell other people's stories. How can we bring the voices, the people with live experiences in these policy arenas, these policy spaces, to tell their stories themselves, right? We don't need to be the messenger of their stories or their message. The second is statistics, and that I think is a challenge for us in the academic community. We need to generate the numbers, whether you like it or not. The politicians, the policymakers will be looking at those numbers. The burden, how much will they save? Our national health insurance systems, how much will they save if we invest in mental health and in climate action? So those are the numbers that we need. And then the third S is solutions, right? Policymakers, they don't like prescriptive or prescriptions or mere diagnosis, right? To be communicated to them. And then when they ask, what's the solution? We can't offer anything. And so, and this is where, for example, organizations like Access Health can be a very powerful partner. Can we start identifying potential interventions that we can implement in different sites in the region? And let's generate the evidence. So next time a policymaker asks, what are the things that work, where, why, how, we have the answers. So stories, statistics, solutions.
Would you like me to add, Iman, quickly?
Yes, please. Yes, please.
The policymakers, enormously important. And I think that 4 decades in public health have taught me that, talking to policymakers about the morality of why they should do something, or because it's the right thing or kind thing to do, it's just useless. Let's not go down that route. If we show them that economically it makes sense, that it makes business sense for their department, and why that is so, why it is of important to business to have a healthy population, or when we start to show those kind of pathways, then they begin to listen. So I think we need to be very practical. We can't be emotional about this. We need to demonstrate to them why dealing with and managing climate and health actually ends up benefiting the kind of policy changes they're bringing. The second thing I wanted to mention is COP28 in Dubai in 2023 was the first time there was a health summit as part of the COP process. And the COP process has been going on since 1988. So who are we to think that, just those of us in this room can make a big difference? Or why should we beat ourselves up because we haven't made a difference? At that level, it has taken this many years to recognize that they need those businessmen, those investment bankers, those heads of government need to listen to health, the health lobby and the health advocacy to understand why the climate crisis is important and it needs to be the top of their agendas. It's got to the top of the World Economic Forum global assessment of risks now, the climate crisis. So, and they put, climate crisis and health up there. So I think it's beginning to change. And the third way by which we can start getting policymakers to listen is by what I call non-cooperative activism. Protest activism works. Of course it does. It raises attention to the issue, but I don't know whether it results in immediate solutions. But if you look at, if we all stop buying things, or if we all stop flying, you can't have policymakers not thinking, oh my goodness, maybe we need to bring back more trains. We can't, we'll have to look at an alternative way of accommodating changed human behavior. If we all moderate our meat and dairy consumption, policymakers have to listen. Why don't we do that? That doesn't get us into prison. That has no penalties. That doesn't get us all medically qualified people deregistered. And yet we don't do the sorts of things that are entirely in our power to do. And we should start doing those things now, and we should start doing them in big numbers, and that's how we can also engage young people, because they're absolutely hungry for action. And it's interesting that this whole movement towards changed diets and wanting to do more walking and litter picking and so on has been generated by young people. It's humbling to see that they are the ones who are leading this battle, not the older, allegedly more wise people. The wisdom is coming from our younger generation. Thanks.
Thank you so much, Mala and Renzo. I think I'm going to take one last question from the audience and then we can wrap up. I think this is a very important question, and it comes with regards to, how can medical students or doctors in training incorporate planetary health into their learning and training, especially when medical schools have limited capacity to train them and they already have a full curriculum.
I can start, so I can give Mala the final word. What I was just writing in our chat box, that the field of planetary health is a very young field. Young meaning, it's new, but also it has a lot of young scholars, practitioners, advocates, students, energizing, this new field. And partly because of the frustration and the anger and the anxiety, right? If you're concerned about your future, then be part of reshaping that future. And they found, what we're realizing is that this is the field that can allow us to do that. Of course, what we need is more support from, the powerful, the ones with the resources to give us the spaces, the platforms. And then, of course, this has to be embedded in education. You already alluded to the already packed medical curriculum. If we add more content in planetary health, some departments might need to, reduce their content. But it doesn't need to be an either or thing, right? And what I'm observing is that the students now, even without planetary health in their curriculum, are the ones creating these opportunities for themselves. I think during this pandemic, I've spoken in hundreds of webinars on planetary health that were initiated not by faculty, but by students. So I think the young people are entrepreneurial, innovative, creative. They're finding their ways, even if the systems are not yet providing the education that they demand. They are the future leaders. They are leaders already now. And I hope that eventually, and if possible soon, they will be provided with more opportunities to make changes, to influence the change in the policy world, right? Because right now, all of these things are happening outside the decision-making table. And of course, that's the challenge. We want more young people to be influencing COP29, which is happening in a few months' time, but also changes at local, national, and global levels. I'll stop there.
The question is about teaching, isn't it? And how we bring this into teaching. And I'm reminded of 15 years ago when I was head of public health workforce in England and decided to make public health my responsibility and lead that whole thing of public health, everybody's responsibility and business. And went and started pleading with universities to make a public health module part of the business curriculum, teacher training curriculum, everything, to show people how through their spheres of influence, teachers can influence public health or businessmen can influence public health. And in that way, I think we just need to start embedding climate into everything. And, I've also been looking at some of the questions that have come through the chat. And people are saying, how do we engage young people? One thing that's happened in Britain is there's been, during the pandemic, the racism that was exposed and the disproportionate impact on ethnic minorities enabled young people and medical students to gain that voice and that confidence to say, we want to decolonize our curriculum. And they've gone about systematically doing that. And 20 years ago, I said, let's put climate change and sustainability into undergraduate medical teaching. And some of our medical schools did that better than others. But it still needs that kind of boost, Renzo, that your planetary health approach may bring. But what I would say is seize the agenda. I think we can't sit here and say, oh, who's going to do this for us? We just have to seize the agenda and do it. We are in the midst of, I don't like the analogy of war, but if we were in the middle of war, would we all sit here in our bunkers and say, somebody's got to come and save us? The answer is no. We find our own ways of doing things. We have reached tipping points now, and James Hansen, the distinguished NASA scientist, believes that we'll reach 1.5 degrees by May this year. So there's no time to waste. It's up to all of us to look at the curriculum and say, you know what? In the universal health coverage policy, why don't we put climate resilience? You can't have universal health coverage without access in climate disasters. So all of us who can see this sense that it makes in wherever we are in conversations to put in that climate, we go ahead and do it. And we join forces with others who are doing it. And there are organizations, I have been the advisor to one called Apolitical that is writing a curriculum for civil servants around the world. Any country can buy into that training program where you could be the civil servants in energy departments, in transport department or wherever, but you get a little module on climate and health and start to reflect on why your role in transport or your role elsewhere is crucial to make that link with climate and health. And it's in that way that we can all ensure we help embed this into the curriculum and also bring young people to come and help us do it, because I think they're the experts in this. Thank you.
Thank you so much, Mala and Renzo. Lots of points made, very valuable. And I think for me, several takeaways, from where I sit in terms of work as well as my personal perspectives, is that one, you can create agency where you see and where it's needed the most, and you don't really have to wait for somebody else to do that. So, and to really contextualize that to your identity, and that you don't have to, worry that that's not relevant, because it is. And to really, three is to sort of understand what policymakers need to listen to, and to focus on actionable, insights, and sort of speak the lingo that really makes it sensible from their perspective to act on. And most importantly, Renzo and Malab, what you both mentioned was about, representation, and also talking about bringing the planetary view, and to look at things holistically, and to sort of go beyond what might be, medically relevant, coming with our, to remove the, the flaps that we have just this one-mindedness, and to look at old, not just novel solutions, because old might still be relevant, and to really talk to a variety of people and a variety of actors. And only when we come together in that diversity can we solve the issues. But we don't really have to do that in a complex way, but that we can all act in our own little worlds, moving parts together towards a common goal. So I think this has been fantastic. And if I could just leave today with two main action points you would like all of us in the health system sphere, even with us at Access Health, what would you see most relevant in the Asian Global South context that we can do to bring this conversation further, and to really act in our own spheres, in the climate and mental health sphere? What's the top two things that you would want, you'd see us to focus on? And I'd end there. Thank you.
Renzo, do you want to go first?
Is it one each or two for each person?
You can go with one or two.
Yeah, well, I mean, there's so many things that need to be done, right? I think my number one wish and hope and prayer is that this may be the first conversation of our community on this subject, but this should not be the last. But also, we need to localize these discussions, right? I think a lot of the discussions now are happening at the global level, now at the regional level, among actors, organizations that do more policy-oriented work or research. But ultimately, which I think has been repeatedly emphasized in our presentations, both Mala's and mine, we need to bring this to the communities, to the schools, to young people, where climate and mental health, is experienced every day.
Iman, what I would suggest is Access Health is influential. It has power. It has agency. There is a lot you can do to convince research funders to fund things that are relevant to South Asia, rather than things that they believe should be relevant to South Asia. Listen and start to bring in that bottom-up approach. Ask for more funding to build that capacity. Bring in more community voices, and start to be that hub of a different kind of approach to research, to conversation, to discussion, to policy development, and start to engage in particular the younger generations who are going to be most affected, because it's good for them from the point of view of their own well-being, but also from the point of view of what happens next. And the indigenous communities and women in particular to come and help build these solutions. I think through that, and as Renzo said, make it local, understand what local means, how nevertheless you, through your hosting of this, can bring sharing of good practice across the South Asian region. This is the most affected, for heaven's sake. This is where things need to happen. Have the confidence to say, you know how to make change happen. we're there, people like us to help and bring us all together to make a difference and make a difference quickly.
Very inspiring. Thank you so much, both. And I leave the invitation open to everybody who's attended to reach out to us. And as we create spaces to continue this conversation globally and locally. And thank you very much for your time and take care. Goodbye.
Thank you. Thank you for inviting us, Iman.
Thank
You're
you.
welcome.
Take care.
Thank you so much.